Did you know that pharmacists in British Columbia can order labs for you? This new authority to order specific laboratory tests has been granted. Beside this new lab requisition authority, I've also tapped into how BC is managing anemia compared to nearby provinces. Currently, data on anemia prevalence in BC is almost non-existent, and nationwide data are also limited. As I take a deeper look into the available statistics, there are a few alarming phenomena, just as alarming as these two statements that you see. First, among women between 15 to 49, there is a rising prevalence of anemia. This is seen from a study conducted from 2011 to 2019. Second, the initiative, quote unquote, raised the bar in Ontario, highlighted that iron deficiency anemia is supposedly silent anemia. And this initiative also responded to inflammation as a confounding to overestimation of iron sufficiency by suggesting the previous ranges of ferritin may have been outdated. Thirdly, a 2022 Ontario study of pregnant women found that almost 1/4 of pregnant women were anemic near delivery. In the same study, only 13% of pregnant women screened for ferritin, and overall 40% weren't screened for the common form of iron deficiency anemia. Pharmacists can help bust many myths about our understanding of anemia and spend the time to identify risk factors of anemia and classify different forms of anemia. In fact, there are already multiple of existing access points which pharmacists can enter to intervene your confusion and concerns about anemia. In this example, pharmacists can tell you that anemia doesn't just affect one type of people. Anemia can affect all kinds of patient populations, from young to old, pregnant, and those with certain chronic conditions. Pharmacists can also tell you that symptoms of anemia can manifest in not just only one way, but multiple ways. Some symptoms include sleep disturbances, low mood, and reduced cognitive performance. Tier 1 is the foundation of the entire service package. Generally speaking, it would start with the risk factor questionnaire, and once completed, it will be provided to our pharmacist. The pharmacist will thoroughly consult you about your symptoms, history of medications, medical conditions, and social drug use, as well as checking if any physical signs suggestive of common type of anemia. If applicable, a medication review may be conducted. Then, if necessary, the pharmacist will assist you with setting up an appointment with the nearest lab near your home and write off a lab requisition. This entire process usually would last around 15 to 20 minutes and a $50 charge for this service. Tier 2 is the full package that includes Tier 1 plus lab interpretation and assessment, and plus a confirmation of diagnosis with your prescriber. Or if you don't have a family physician, then we'll help you find a prescriber. If a patient decides to receive the full package after paying for Tier 1, we would also allow this and collect the remainder $50. For Tier 2, the entire process will last usually 30 to 40 minutes, and this is for a total of $100 charge. Tier 3 is just as important as Tier 1 or Tier 2 because follow-up for improvements of lab values are crucial for knowing whether the treatment recommended is working or not. Even if it's effective, there might be side effects patients struggle with. It's also a good opportunity to check if there are other rising concerns from the patient. This process will take usually between 10 to 15 minutes, and it would require a $20 self-payment. Speaking of concerns and questions from patients, oftentimes when I see a patient hands me this prescription, you see here, I would first ask them, what did your doctor tell you about this prescription? They almost always would say, I don't know. The doctor didn't tell me much. The doctor told me that the pharmacist will tell me about everything. Now, I become confused and frustrated because I see first fragmented care, second inefficiency of care, and 3, zero information about how this patient is using the iron supplement to treat, for example, what type of anemia, or if it's not anemia, or is it just deficiency of iron? I don't really know much from this one prescription. With this anemia clinic implemented, I'd like to tackle barriers, for example, long wait times before seeing primary care physician about anemia. difficulty to finding a family physician to even hear them out, and poor follow-up after initiation of proper treatment. Pharmacists are here to help. With our approach, we can make sure that time is not an issue. Secondly, we are always accessible by being there to answer questions, inquiries, and before we actually deliver the services for this clinic, we are there for information advices. Lastly, we can make sure it's a good continuity of care by being collaborative with the physician and also making sure it's a two-way communication that involves patient there as well. Now we get a fully balanced situation by being there and being accessible and saving your time. Investing in your health is a concept that's often hard to visualize. Pharmacists can help you save time and be accessible for inquiries, as well as provide you a good continuity of care. This is investments in your health. Now, the decision is in your hands to make pharmacists your first stop for tapping into smart ways to invest in health.